Since the beginning, this has been a team effort, first starting with all of you, our city employees and cities across this county, our amazing county workers as well. And here at Los Angeles City Hall, we've been blessed to have a group of elected officials working together. And our city council is led by our guest who is here this evening, our city council president, Nuri Martinez. We're so glad she could join us to talk about some of the great work the city council has been doing. And I want to thank her and all of her colleagues, as well as our city attorney and controller, for really being a united team when this city needs us most. From day one of this crisis, I've said this city will never stop working for you. And every day that's embodied in our first responders, our firefighters and police officers who are on the front lines, our public health workers and others, our interpreters, people who are doing the work to make sure our communications are clear, that our actions are strong, and that each one of us can continue to do the part to save lives and to rebuild livelihoods. And I know this is going to be a big weekend for us. It's a big test, and it's an exciting weekend. It's a threshold through which we take our first baby steps of not closing things down, but of seeing them reopen. And I just want to review a few things before we get to the data and today's development. First, it's really important to remember, we're not stepping into a brand new place. This isn't the flipping on of a switch where everything changes and it goes back to normal. We're not going to go back to normal the way life was before this pandemic for a long time, for months and probably throughout this year. We still cannot hold gatherings. We still cannot get together with people outside our households. And we'll be in this new reality as we move from reacting to this crisis to trying to build a safer and stronger LA. Sometimes we'll step forward, as we announced we are going to do yesterday, when we said that golf courses and trails and trailhead parks can open this Saturday. And certain non-essential businesses can now open for curbside pickup starting tomorrow. And please, I want to say one thing, just as I said early in this, that if you could order out from a restaurant to help them survive, it's the same thing for our other retail stores. Order some flowers for your mother or for your household next week from a local store. Order your books from a local store. Order some music from a local store. Get some clothes from a local store. Maybe you've never bought online or called those stores ahead of time, but these are local jobs. And these employees are local employees. So I know that we've seen big chains and national distributors help us get through the first couple months, but let's shop local whenever and however we can to make sure we're spending and recycling our dollars here locally, paying taxes here locally, helping people earn a paycheck locally as well. And we won't hesitate to step back from these steps if we don't get this right. So remember, folks at our golf courses will be required to wear our face coverings. Folks on our trails will be required to wear face coverings. And if you're gathering in groups or if you're not physically distancing, if you're not wearing face coverings, we will again close down these things that we are opening up. So let's take these new freedoms and use our responsibility to make sure that we can get through this. At golf courses, it's going to be reservations only for LA City golf courses. As of this morning, golf bookings were 80% filled. So not everybody's going to be able to go on a hike this weekend. Not everybody's going to be able to play golf this weekend. So plan accordingly. If you aren't a critical worker and you're at home, maybe think about doing that this coming week instead of the weekends. And at the golf courses, there will be fewer tee times. We're making them every 12 minutes instead of every 8 minutes. Only one person per golf cart. And foam fillers have been added to every hole so that you can pick up the balls without touching a flag. Griffith Observatory remains closed. There will be no parking up at the observatory, and some parking lots will be closed and capacity at popular trails will be limited so that we can make sure that we aren't breaking the physical distancing requirements still mandated by our county. If you're going to go to a park, don't everybody go for Mother's Day. If you've been staying with your mother, you've seen each other a lot, you don't need to necessarily do that on Sunday. And for those whose mothers may be a little bit older, remember, it is still the county recommendation in our order that folks over 65 stay at home. And again, if this becomes dangerous, we will close it down, but our decisions are guided by our public health experts and data. So to see our key indicators and to see the stage that we're in, go to that new page that we've set up at coronavirus.lacity.org/saferLA. Having this information publicly accessible is really important. Today we learned that the federal government has withheld publishing the CDC's specific guidelines for our nation. That's unfortunate. But there are specific guidelines on reopening the county and LA that are ready right now. Second point, these small steps mean different things for different people. For everyone, it is still our foundation that it is safer to be at home, to stay at home. That's even more important if you're a senior, if you have an underlying health condition, if you have a disability, you remain safer at home. And if your business is not an essential business, or permitted business, you still must be closed or work from home. Nothing else has changed. And that brings me to my third point. This only works if we all do our part to save lives. That means wearing a face covering if you pick up groceries or visit an essential business for curbside pickup. And I'm so grateful to our partners at Metro today for announcing all bus and train riders will be required to wear a face covering beginning May 11th. And thank you again to Supervisor Hahn and my fellow board members at Metro for her and their work on this. And thank you to Metro CEO Phil Washington for taking this step, even when the agency I know has been financially taxed. It is doing everything it can to provide that critical service to all Angelenos. So what does this mean? It means practicing safe hygiene. It means proper hygiene, by frequently washing our hands. It means practicing safe distancing, always. And we know that decisions become data, tests taken, cases counted, and unfortunately the worst data, lives lost. Let's not make the data any worse. Let's do everything we can to make the data better. And with that, let's check the data out for today. Today, the County of Los Angeles reported another 815 confirmed positive COVID-19 cases, bringing the total to 29,427 diagnosed cases. This is a 3% increase since yesterday. Now, a 7-day average has seen about 916 new cases announced each day. In the city, those numbers were 385 new cases and a total of 14,253, also a 3% increase. And today we learned again of those who are fallen, 51 new deaths that were confirmed in the last 24 hours, bringing our total to 1,418, a 4% increase since yesterday. And we've seen an average daily increase over the last 7 days of 45 new deaths. Now, I want to make a point here. A week ago Thursday, when we looked at the previous 7 days, the average was also 45 deaths. 45 deaths is 45 too many. But that number is holding, and it's holding because of you. Deaths are usually a lagging indicator, 2 to 3 weeks behind some of the data we have on new positive cases. And it shows us that things are not getting worse. But I pray for and hope to see those death numbers come down this coming week and the week ahead, showing us that we haven't just bent the curve, but hopefully we have flattened it. Across the county in our general emergency hospitals, there are now 1,046 beds currently available, including 828 acute care beds and 218 ICU beds. People are still going into hospitals because of COVID-19 each day, but we have an inventory of 1,048 available ventilators. And as you know now, anyone can get a testing appointment with or without symptoms. In the 36 testing locations across the city and the county where you can walk up or drive up, we have the capacity to test 20,500 people. And by the end of today, those centers will have tested approximately 241,000 residents of LA. So go today to get a test. Sign up at coronavirus.lacity.org/testing or call us during business hours at 213-978-1028 or through 311 after 5. As we continue to test Angelenos, as we continue to track the spread of this virus and tackle our first priority, which is the dangerous threat to public health, to save lives, we remain focused on the other effect of this pandemic, how devastating it has been to the economic life of Angelenos. One way we've met this charge is through our work of our Department of Water and Power, by halting shutoffs, canceling penalties for late payments, and extending payment plans. And as we start our small, gradual steps towards our new reality, we keep looking for new ways to support our customers and to help Los Angeles families. To that end, tonight, I'm announcing that DWP will not shut off service for non-payment for the rest of 2020. For this entire year, we will not shut people's water and power off. Now, let me be clear, if you can pay your bill, you absolutely should, as your payments help us provide reliable service across the city. But if you're facing financial hardship and you can't afford to make every bill on time, you won't have to worry whether the water will the water will come out of the faucet or whether the lights will stay on. All ratepayers still must repay their bills down the line, but this measure gives everybody a little bit of breathing room. Like I know that Council President Martinez and her colleagues have done together with this office to make sure with folks not being evicted from their housing. These measures matter, and these measures help us see brighter days ahead. And I want to add one more reminder to the establishments, the businesses that are permitted to open for curbside pickup tomorrow. Stagnant water in our pipes can promote the growth of bacteria and lead and lead to corrosion, especially in older buildings. So as you prepare to get your operations back going, make sure you turn on the water and let it run for a while. Run the tap, flush your plumbing systems. Doing that will keep your workers and your customers safe if you haven't been there for a few weeks. The relief that we're providing to Angelenos comes in many, many different forms. I reported to you recently that because of the generosity of so many of you and your fellow Angelenos, that we had our original goal of raising $10 million to help 30,000 people with Angeleno cards, that we were able to double that to $20 million, now helping 60,000 of our neighbors. And we've already distributed close to $6 million in cards. In our first 10 days of distribution, we helped 16,000 people living here in Los Angeles with Angeleno cards to meet their basic needs and necessities. We're on our way to 60,000 total. It's a massive effort, and it's nation leading, and it's moving fast. And we're taking our experience of the last 10 days to help us be even faster with new computer systems and moving forward with following up folks who we've called already 4 or 5 times with no answer, but trying to track them down to make sure we can find them and we can get them their Angeleno card. With unemployment levels continuing to soar, many, many more people need help now and will into the future. So please continue to donate at mayorsfundla.org/Angeleno. Every dollar helps. The city is committed to doing everything we can to help you make your ends meet. And a big part of that work is focused on protecting our city's renters. Earlier in this crisis, I ordered a freeze on rent increases for 624,000 rental units under our city's rent stabilization ordinance. And this week, the City Council continued that action by voting to extend the freeze for 1 year after the crisis ends. I was proud to sign that law today and guarantee that renters across our city will continue to get this much needed relief. This freeze is just one part of our ongoing efforts to help people stay healthy and housed in their time of need, to take care of renters, to ensure no one is evicted because they can't cover rent, and that no bad actor can take advantage of a tenant. And we're constantly reevaluating, addressing issues that might emerge, and making sure that the rules we enact aren't just words on a piece of paper, but protections that are afforded to you by your landlord. That's why today I signed another new law passed by your city council to prohibit landlords from using coercion, intimidation, or fraud to get their renters stimulus checks, and to provide tenants with a private right of action if their landlord has violated any of the protections that the city has extended to them during this emergency period. This measure also requires that landlords provide you with our housing department's protection notice every time they contact you about your rental agreement during this period. The notice must be provided in the language that is predominantly used by the tenant, and for landlords and tenants, that can be found at hcidla.lacity.org. I applaud my city council colleagues. It's an honor to serve with them and to see their leadership, led by our city council president, Nuri Martinez, for supporting renters. And you're going to hear from her with some more things in just a moment. You've heard it from me, and you've heard it from our city council. This crisis is serious. This threat is real. COVID-19 kills. So even as we take steps forward, we have to protect each other and we have to protect our lives. It is better in the path forward if we stay safer at home whenever we can, and that we listen to science and medicine, that we listen to doctors and public health officials, that we not play politics with our lives or with our city. That lays the foundation for a stronger renewal, not just a good response and a reopening, but a renewal and a reimagining of our city to come back economically and in terms of our health stronger than ever before. So as always, I'm sending you strength and love. And with that, I'm going to hand it over to our City Council President, Nury Martinez. Thank you for being here, Madam President.
Thank you. Thank you, and Mr. Mayor, and thank you for your leadership during this pandemic. Beyond calling for this state of emergency early on and working with our partners at the LA County on health and safety guidelines and taking bold and necessary steps to close our businesses before others did, clearly has saved lives. I do want to join our fellow Angelenos in thanking you for your message of hope and unity as we work through to control COVID-19. Good evening, my fellow Angelenos. As the Los Angeles City Council President, I am here tonight representing the 15 council districts and your representatives who serve you on the Los Angeles City Council. As we slowly but surely begin to reopen our city, I want to thank each and every one of you for your incredible sacrifice, for putting everything on the line and staying home, following social distancing, and wearing masks. Your commitment has not only helped you and your families, but you have also helped countless other people you will never know. Because of your actions, they will be able to live to see another day. Thank you to all of our essential workers, our first responders, our frontline workers, doing their jobs at the police and fire department, our hospitals, and also our grocery stores and restaurants. And for the families who have lost a loved one and others who surely will, as a mother, as a wife, and as a daughter, I send my deepest, deepest condolences. God be with you all. When I became president of the City Council in January, I laid out a Families First agenda. I am a daughter of Mexican immigrants who became part of Los Angeles' working poor. I grew up in Pacoima in the Northeast San Fernando Valley, and I see public policy through that life lens. I said then that the Los Angeles City Council was going to prioritize working families, women and children, and those who are doing barely enough to be able to get by, and people living paycheck to paycheck. And during COVID-19, the City Council has enacted some of the most progressive family first legislation to protect fellow Angelenos, particularly the working class and the working poor, who will need us more than ever. And in Los Angeles, we have more renters and homeowners, many who have very little savings to be able to live by. Los Angeles and the Los Angeles City Council has enacted one of the most robust and legally defensible eviction moratoriums in the nation during this pandemic. If you can pay rent, you should. You should be able to pay back your rent, and you should be able to work with your landlord to be able to make payments accordingly. But if you cannot pay rent because you've lost your job or because you've been affected by COVID-19, then you have the right to be able to submit in writing within 7 days that you cannot make that rent. That's all you need to do. The city, with the support of our mayor, has enacted legislation that says you cannot be evicted during this pandemic if you cannot pay your rent, or if you cannot pay it entirely. And we give you about 12 months to be able to repay it back once the pandemic is over. And yesterday, the City Council, while recognizing that some landlords are doing the right thing and working with their tenants to keep them in their units, there are some unscrupulous landlords who are using intimidation or violating the long list of provisions and protections in our renters eviction moratorium, including trying to illegally get tenants to sign over their government relief funds to these landlords. To those landlords, we've given the tenants the right to sue. The tenants can now be awarded as much as $10,000 per offense or $15,000 for those over 65 years old or disabled. And the City of Los Angeles praises a majority of landlords who are working with their tenants to be able to work something out and keep them in their units. But for the bad ones, particularly those in Black and brown communities like the ones I represent, with large immigrant populations that are vulnerable to fraud, intimidation, we are putting you on notice, and we're asking you to stop this behavior or you will pay the consequences. The City Council voted yesterday to expand the mayor's executive order to freeze rents on RSO units until a year after the emergency is lifted. That covers 75% of the rental market here in the city of Los Angeles. And along with the units 15 years or older, with rent hike limitations that the state implemented in January 1st of 2020, about 96% of Los Angeles rental units are now covered by either our RSO freeze or AB 1482. For a full list of your rights as tenants and renters, or for landlords, and to follow your responsibilities, please go to HCIDLA2 at lacity.org. The Los Angeles City Council also voted to approve bringing back the Renters Relief Program that I first enacted in October of last year after AB 1482 became law and some landlords were rent gouging some of our tenants. We filled in the funding gap for those tenants to make sure that they stayed in their units after the law went into effect on January of 2020. We are creating a similar program now because we know that when the pandemic is over, particularly low-income families without savings will not be able to pay that rent back, especially if they don't have jobs to return to. And the COVID-19 Renters Relief Fund will give rent money directly to landlords so that they can meet their financial obligations and that they can be able to pay their mortgages and we can keep our tenants in their units. One thing to be very mindful of, today, the majority of rental units owned by individuals, there are the units, if they lose their units or the units fall into foreclosure, they can very quickly we can become a majority corporate-owned rental market, and none of us want to see that. While we've done everything that we can, neither the mayor or the Los Angeles City Council has the legal authority or the financial ability to do more, as much as we want to. And we need the state's assistance, particularly for renters and for landlords, to be able for them to keep their units and for us to keep people housed. We need a significant funding assistance from this federal government. Los Angeles' very own Congresswoman Maxine Waters and Senator Sherrod Brown have both introduced legislation to provide $100 billion in renters relief funds to make sure that cities like Los Angeles does not collapse when we don't have true dollars to be able to assist people with their rent or keep people from losing their property. We need this assistance more than ever. I applaud them both and I support wholeheartedly their efforts, and I hope that our federal legislators can build the momentum that we need to make this a reality. The Los Angeles City Council has also taken steps to protect workers. We led the way with COVID-19 related paid leave program for families dealing with the pandemic, for employees working for large businesses and corporations. We enacted the workers' right to recall and retention ordinance to protect housekeepers, janitors, maintenance workers, and security guards who have worked their entire lives to pull themselves out of poverty, only to lose their jobs, lose their seniority, and have to start all over again. The city of Los Angeles rejects that. We should have an opportunity, and they should have an opportunity to return to their jobs once that is available to them. If a corporation, a hotel sells their hotel to another corporation, that housekeeper and those workers should have the opportunity to continue working. The people at the bottom making the fewest dollars should not be treated as an afterthought, disposable, or something that we can throw away. And we enacted protections for our frontline market and retail workers to allow them to take time off for COVID-19 related reasons. All these actions have been taken and have been a big focus of the LA City Council. We want to do the right thing, and we want to be able to protect every single Angelino. We want to be able to focus on people and not corporations. We want to be able to return to our regular lives, and we want to be able to get people back to work. And lastly, I want to thank my colleagues on the Los Angeles City Council for enacting these and other measures. I also want to thank them for their advocacy and direct participation in arranging food drives, diaper and toiletry giveaways for our needy moms, our homeless women, and creating senior programs to protect our most vulnerable during this crisis. We stand together as a legislative body to enact laws to protect you and work with our mayor to make sure our efforts are ongoing. In good times and in bad, we will be doing everything we can to serve you, the good people of Los Angeles, with a family-first agenda to provide you whatever assistance you shall need. Thank you.
Thank you so much, Council President Martinez, and it's an honor to serve with you and your colleagues. You are doing the right thing every single day, and thank you to everybody in Los Angeles who is doing that as well. So we'll have another address tomorrow before everything opens up, but to the stores that are opening up tomorrow, we wish you nothing but the best. To everybody listening tonight, order something local that you might be able to pick up in your neighborhood. Let's get our businesses back and going. Let's get our jobs going strong. That's the best way we can rebuild Los Angeles as long as we do it safely. As I said before, strength and love, Los Angeles. And with that, both the Council President and I are happy to take questions. First question, please.
First question comes from the line of Robert Kovosik from NBC. Please go ahead.
Hey, Robert.
How are you, Mayor Garcetti?
Good, thank you. You?
A lot to cover here, but sure. We'll whittle it down to two. Earlier today, Dr. Ferrer said that we won't know about the impact of reopening and if there is an influx of cases from phase 2 and just how great that potential influx of cases could possibly be for a couple of months. So does that mean we could potentially have to wait a couple of months before we begin phase 3? And I just want to get your initial reaction to the governor's projection of a $54 billion budget shortfall and what you anticipate happening here in Los Angeles from education to possibly rolling back a minimum wage increase.
Well, let's start with the first question. And thank you, Robert, as always, for both of those. First and foremost, Dr. Ferrer is right. And I've been in very close discussions with her practically every single day. We thought maybe 2 to 4 weeks, but her recommendation, and I agree with it, is about every 3 to 6 weeks, maybe 3 weeks for baby steps. But every 6 weeks is when you can kind of really see a 14-day cycle, the spread to a secondary group, and then unfortunately the mortality that comes when we have new cases. Whether steps we've taken are tolerable, because I'm never going to say safe, tolerable to hold, whether they are exceeding our expectations and the rest of our actions continue to make progress and we might take new steps, or whether we have to retreat. I hope we can retreat as little as possible, but that will require patience of we enact something and then it takes, those 3 to 6 weeks to assess where we're at. Second, we have to do those things together and we have to make sure that that's being done up and down the state. You asked whether when we get to phase 3. There's many steps within phase 2 that are the next things that would be on the table long before phase 3. We have things that are recommended in the state, and as Governor Newsom said, some counties may get further into that phase 2 earlier than places like, as he said, the Bay Area or Los Angeles, where we have many millions of people, where we're not spread out with a few thousand people in a county the size of LA as we have in some of our California counties. So we can expect to have a slower pace here and a careful one, because again, this isn't about us going too slow. This is about if we go too fast, that not only do we retreat, the economy shuts down again. So the best way to build up an economy is slowly and carefully and strongly, not kind of rashly and impulsively and without those numbers. Second, in terms of the deficit, absolutely, that state deficit is going to be devastating. Devastating to Los Angeles, devastating to every community, every school district, which is why I joined the governor and my fellow mayors and county officials across the country in calling on Congress to make sure you don't forget state and local governments. Let me put this in perspective. State and local governments spend $3.1 trillion a year. We spend that in our local economy. When our employees get paid, those dollars get recycled 4 or 5 times. We buy things here locally. We keep the economy going. And at a time when first responders and medical professionals who work many times for county and even for the city are on the front line saving lives, it would be devastating to see those sorts of cuts across the board. How are we going to open up a school district if a school district faces a cut of a third? How are we going to keep our firefighters and our police officers responding to public safety and to public health if we have those sorts of cuts as well? So Congress must do, as many congressional leaders have called for, as even the president himself tweeted after the 2.5, he said, next states and local government, until the Senate leader made this a partisan and political issue. But red, independent, and blue cities and states are America. And I'd remind any political leader who thinks this is about blue-run states and cities, are you going to walk away from Republicans in those places? I represent anybody, whether they're Democratic, Independent, or Republican in my city, because that's what I was elected to do, and they should too. Next question, please.
Our next question comes from the line of Claudia Pescuta from KNS News Radio. Please go ahead.
Hi, Claudia.
Just have some questions about the testing sites.
Sure.
I think you said last night that the sites can currently handle about 18,500 people a day. Is that correct? Is that the current capacity? And I'm wondering how many people are showing up each day. Are you noticing more demand in certain parts of the city? And any thought to adding more walk-up sites for people who don't have cars? Thank you.
Yeah, we've heard about the walk-up sites. We have one right now in Echo Park and one in South Los Angeles. Absolutely, we're open to that, and I know the county is as well. So we'll continue to look at that, and we have a lot of proactive walk-to-people sites for folks that are experiencing homelessness, for seniors that are stuck where they are in senior nursing facilities, as well as other institutional settings too. The capacity, let me make sure I get this right. We talk about what the capacity is, the number of tests. We have the capacity right now to test 20,500 people a day. So we are confident. That doesn't happen every day. The reason we started expanding to people without symptoms who are critical workers and then people without symptoms who are just everyday Angelenos was because we had 2,000-3,000 tests sometimes going unused each day. Now we are pretty close to capacity, but the good news is, as I announced last week when we said this, is we can get more tests. So each day we're adjusting to that, ordering more if necessary. I know the county's doing that, and the state has announced they're bringing state testing sites online. We're trying to make sure that that's through the same portal, so it's not confusing if there's a few state sites here in Los Angeles County that some people would have to go through one portal. The city and the county use the same software, the same portal to make it easy. And you can be a city resident and go to a county site. You can be a county resident and go to a city site. So I hope the state can get there too. But the measure that folks talk about that you need to reach to be able to reopen things, or the amount of tests, is about 15,000 tests for every 10 million people a day. We are now at that. So that gave me the confidence to take these first steps, that while we haven't hit every metric that's recommended by at least the drafts of the CDC, we'll see if the draft ever becomes official because of the politicking in DC, but what the state has established today and some of the metrics they put forward, it is that 10 million people, which is our LA County, you'd need about 15,000 tests a day, and now we're doing that. So that's a really positive sign, but we'll continue looking at how we can get that more. Ideally, one last thing I'll say, through the long haul, we hope people will get tests through their providers and through local drugstores and things like we do with our flu tests. So we will continue standing this up until then, but insurance companies should be paying for these. They should be going through, our medical providers, and that will be a necessary part as we open up more of the economy and there's even more demand. Even if some workplaces say, we need to make sure you've gotten a test on infectiousness in the last day or two, we hope that they will also take up some of the slack in a way that people go to doctors today. Thanks, Claudia. Next question, please.
Our next question comes from the line of Bill Malushin from Fox 11.
Hey,
Please
Bill.
go ahead.
How are you?
Hey, Mayor, thanks for the question.
Of course.
So during yesterday's City Council meeting, Councilman Bonin suggested that any hotels refusing to participate in Project Roomkey could potentially be guilty of civil rights violations. And he took it a step further and suggested that the city might want to take a look at commandeering these hotels. Do you agree with his comments? And will the city look at forcing these hotels to house the homeless?
I'll repeat what I said last night, is that while we might have the rights to do certain things, and I'm not scared to use those powers, everything costs money. When you commandeer something, it still costs money. And we shouldn't necessarily commandeer the most expensive, $500 and $800 hotel rooms when we can house more people for the same dollars for less. So we're trying to negotiate each of those deals. We've talked to over 800 hotels. Many motels and hotels contacted us. This past weekend, we increased by 50% the number of beds, got another 1,000. But yes, we've helped some hotels get on their feet. We've helped them go through things like redevelopment, and it would be good for them to give back. And so many hotels have, for domestic violence survivors, for people who are experiencing homelessness, for our first responders right now, some of whom can't go home to their families, so they're staying in hotel rooms, as well as people who have need to either isolate because they do have COVID-19 or need to quarantine and can't do that in home. So all four of those things are being used in hotels. We want to see even more rooms, but between our shelters and the rooms that are being used for folks who are experiencing homelessness, it's pretty amazing that in 6 weeks or so, 3,000 people have come off the streets. If we could double that again the next 6 weeks or so, that would be pretty great. That would be the biggest movement of people off the street in LA history in the shortest amount of time. And then, as I've always said, step two, you could buy a hotel and burst through all of your money in a single hotel that only houses 500 people. Some hotels are very expensive. We should think really smartly about whether it's looking at the trailers that we have and moving them to sites that are more appropriate long-term out of our rec centers, whether it's popping up easy to build units that folks like our Carpenters Union have worked with architects to do, or in the open marketplace, giving people vouchers to get into housing, because I know the council president, myself, we don't want to see people return to the streets. We do not want to see after this is done that those people we house suddenly become another statistic. So I would say hotels step up. We've gotten a lot of rooms. We still have vacancies in them right now, but they are filling up quickly, and people should do the right thing, but I'm always going to make sure we get the most hotels bang for the buck that we can. Thanks. Next question.
The next question comes from the line of Eric Heintz from City News Service. Please go ahead.
Hey, how you doing, Eric?
Hi, Mayor. Good evening. Thanks for the question. I was wondering, just on the DWP bills that are going to be not collected for the rest of the year, does that apply to commercial and residential?
Yes.
Or just residential?
It applies to both commercial and residential. Thank you for the clarification.
And how long will people have to pay back those bills? Is that similar to the rent deferral?
I believe it's 12 months, but let me double check on that. I think it is a 12-month period of time. I don't think we've set that yet, but we're going to be talking to DWP about how long that will be. But certainly we just wanted to let people know that they can have the security right now, that this year you won't get those sort of shutoffs. But people should pay if they can, or pay whatever they can now. That's the smart thing to do, but we haven't set the months yet. But we'll look at nailing that down. Did you want to add anything on the hotels, Council President?
No, I agree with you. The only thing I want to add is nobody wins, and if we get stuck in years in litigation with some of these hotels. I mean, I think what we're all trying to accomplish is making sure we've got the cooperation of some of these larger hotels in downtown. We're currently working through that process, but we also have to be realistic that we don't want to be tied in litigation for years where we're spending money and we're also not housing anyone, so nobody wins in that situation. So we want to make sure that we can get as much cooperation as possible and move people quickly into these hotels, but also take a look at the ones who are not cooperating, and hopefully, if we have to publicly shame them, maybe that's something we can take a look at, Mr. Mayor.
Yep, happy to do it. Next question, please.
Our next question is a follow-up question from Robert Kovosik from NBC. Please go ahead.
Go ahead, Robert.
Lucky day to speak with you twice. Mayor Garcetti, do you have any more information as to what Governor Newsom talked about today about the community spread in a nail salon, and that's really what kicked things off here in California? And what is your intel coming into your office regarding children now being admitted to hospitals suffering this immune syndrome related to COVID-19 here in Los Angeles?
Yeah, in the second one, I've just read a few things about it nationwide, but I don't have any new intel here in Los Angeles, nor have public health officials told us that they are seeing a huge outbreak of something with this immune syndrome with children who, as we know, have been much less affected by COVID-19, though plenty of people under 65 have been. No, in terms of the governor's address today, I listened to that. I felt like I was watching the end of Contagion, and you finally get to the scene where you know where it starts. I didn't hear that it started in a nail salon. It did reinforce for me that as much as people want haircuts and some people want to get their manicures and pedicures, these are tougher spaces and really require us thinking very intelligently about making sure that spread doesn't happen there. Same thing with religious institutions. I'd love to get back to services. I've been praying on the phone with a group of pastors and rabbis and imam. That is important to me too, but we know how many stories started in a church gathering or a funeral. So those are places I think that require us to go a little slower, but no, I had not heard that before I heard it from you. But we'll follow up and see if we can find out some more information about whether state public health officials have actually done the tracing now and the tracking backwards to confirm that that's where it first happened. Thanks, Robert. Next question, please.
Our next question comes from the line of Francine Kiefer from Christian Science Monitor. Please go ahead.
Hi, good evening.
Hi, Mr. Mayor. Thanks for taking my question. When this first started, the goal was to flatten the curve so as not to overwhelm hospitals. What is the health goal as LA starts to open up businesses? Is it, to suppress new cases down to zero like they're doing in Hong Kong, or is it somewhere in between? What is the health goal now that we're moving into the second phase?
I'd love to be that ambitious as we see in Hong Kong or what we saw in island nations like New Zealand and Australia to actually get to a place where we could imagine getting rid of it or getting cases down to zero. But I don't pretend that unfortunately in this country where we haven't lifted up and paid enough into a public health infrastructure that we can do that. So what guides me is maintaining cases below our hospital capacity, even as we move forward. That same thing we did that we were scared at the beginning, that it would be the speed of spread that would overwhelm our hospital capacity, is still the same thing in phase 2 that is our central concern. So if we don't wear masks when we're hiking, if we don't practice physical distancing when we're picking up things from the curb in these new stores, if folks are golfing and they decide nobody's looking, so 2 of us should get in a cart together and things spread, that will begin to contribute to more people spreading to more people, spreading to more people, which will overwhelm our hospital system. That will endanger the lives of our doctors, our nurses, our medical professionals. That will cause more people to die, and that will cause us to close things down. So it is still our public health goal to now manage infection. As I've said, it's no longer black or white. It's not black, we can't throttle this economy until everybody suffers so much we have no livelihood for anyone. And we can't open it up and say, hey, we're all free, let's go for it. And somehow we've bought enough masks to deal with the spread. This virus will spread much more quickly than the number of masks we can ever buy, the number of doctors that we have, the number of ventilators we could ever find. So now we have to manage that gray space in between and make sure we're looking at those triggers. And the most important ones to me, because they're the quickest, how many people are calling in with COVID-19-like symptoms to their doctors, and how many people are being admitted to hospitals. That's something that often comes even before we get the positive tests back, and certainly before we get deaths, which is a lagging indicator. If those things start to skyrocket or we see a steady uptick for more than a day or 2, we need to look at what we're doing and we need to withdraw some of the things we're doing or ensure that there's enforcement of safety measures. And the last thing I'll say is I have confidence we can do that we can manage this space, but it'll be more than government doing it as much as we have business ambassadors and we'll educate, we'll encourage and enforce. We've done it with farmers markets, we've done it with construction trade where we've shown people we were able to take that risk down, but it really depends on everybody who's listening and watching right now. We can't do it together, only you can. Thanks for the question. Next question, please.
And our next question comes from the line of Erica Martin, our last question in the queue.
Hi, Erica.
Hey there. I had asked you this earlier this week, and you addressed it at the beginning of your address about small group gatherings in private still not being allowed.
Yeah.
But I was wondering how much longer you think it will be until that becomes something that is lifted.
So, Dr. Freres talked a little bit about kind of pods in the future, where we're not going to just lift it because you could have a dinner party every single night with 9 new strangers, and that's a very risky thing to have. But it may be that in the future we allow some interactions under a certain number, and we encourage people to have a group of people that they know, maybe everybody has been tested, and you stay kind of with that now slightly bigger but regular group. So it's a household plus. But it's not, I don't see any time too soon with the amount of cases we still have, deaths that we have, where we're going to be encouraging people to every single night being in even small groups with new people each time. That's how this thing spreads. As a doctor was saying yesterday to me, this virus thrives on cities. What makes cities so exciting are the places where people come to eat together, to listen to music together, to dance together, to watch sports together. And they often come from different neighborhoods, different cities, or even different regions. And that's where the spread has occurred. So I think we're still a way off on that. The stay-at-home order stays in place. Next Friday, it's not that that's lifted, it's just altered. We alter it, and we'll of course have to extend that deadline. A number of people have asked that. The county will take their lead on it. But as some cities have done, places like Pasadena, just have it open-ended, because until we have a vaccine, we're going to be living under some orders where we have to make sure we are protecting ourselves, not gathering in big groups. And I will take that guidance, as always, from Dr. Ferrer and from County Public Health. Thanks for the question. We got one more question, I think?
We do have one more question in the queue from the line of Steve Gregory from KFI News.
Please, Steve, how you holding up?
Hey, Mayor, I'm so sorry. I caught everything late, and I
Don't worry.
want to apologize if I'm asking a question you've answered or addressed, so I apologize. The Public Safety Committee meeting today indicated that there was some tensions going on behind the scenes between the city and the county. In fact, they were talking about certain concerns over not having the city and the county in alignment with reopening strategies. And I'm wondering if you might be able to address that a little bit, or if Madam President wants to address that. Also, are you familiar with the edict that came out from Dr. Galley today from the governor's office about the stage 2, the second part of stage 2, about having no more than one positive case per 10,000 people in 14 days and no COVID-related deaths in the last 14 days? Seems like some very impossible criteria to reach. I'm wondering where you're at with the rest of phase 2. Thank you, sir.
Absolutely. Thank you. And I'll let Council President add anything as well. Nothing could be further from the truth. Just in the last 24 hours, I think I've spoken to 3 or 4 of the 5 county supervisors. Dr. Ferrer, it might be the first call in the morning and the last call, as it was last night. I talked with Dr. Galley at the state level. We are working so well at the state and local levels. I convened a phone call of 88 county mayors yesterday. We are only able to do as much as we've done because we are marching together. Do we have robust discussions about what measures, what timing? Of course. I have those within my own office too. Our city council and our administration are working incredibly closely together. I might put something out and then they pass it as an ordinance. They might put something out and I make it an order. I mean, we're really marching together. So no, I think I can categorically say we're working extraordinarily well together. These have become not only great colleagues, but some of my closest friends during this as well at the county level. And we look forward, whether it's on homelessness, whether it's on testing, whether it's on making sure that we keep people safe with these orders, we will continue to be in lockstep. In terms of Dr. Galley, there's 2 Dr. Galleys, of course. There's Christina Galley, who's doing a great job with health services here in the county. Her husband is the head of our health, public health at the state level. And no, he told me about these last night. We talked actually on the phone. We've been developing these, and our staff has been working very closely with the state. These aren't secrets. These are shared by medical professionals around the country and the world. And I've read probably 40 or 60 different reports from Nashville, Tennessee, from Denmark, from Seoul, about what these measures are. And we're all kind of zeroing in on what those are. You can't get 100% green light on all of them, which is why the dashboard that we've put out, and we'll be adding colors, taking the county's lead soon. I think the county was looking at 11 measures. We proposed, 6 or 7, and the state now has put out 7 as well. We need those to be aligned, but it is true. We need this many people per 1,000 residents for contact tracing, this many tests per 1,000 people. And in terms of the cases, we do need to have some standards, but unlike a county that maybe has 9,000 people and is spread out in a big area, we probably won't get to 0 deaths for a long time. I wish we would. I pray that we will. But we will have to take some steps knowing that when you have 10 million people, statistically, you might not get as low as somebody who has, 1/100th or 1,000th the number of residents as you. So I think their metrics are good. I'm certainly going to be using as many of them as I can to make my decisions and what I recommend to the county. And I know the county is as well. And I believe they're going to be releasing the county versions of those in the next couple days as well. But in terms of, I know the council president's been working.
To ask you to, so you're saying that the formula I just gave you from the state does not apply to the city right now, or is that something that you're working on? Because there's a lot of confusion about the city, the county, and the state working together.
Sure. So the city and county are very aligned in terms of the indicators. We're going to have the exact same ones. In terms of the state, they have acknowledged there's a diversity of geography, and so they're recommended ones. Like most of the state stuff, they kind of give you the guardrails and other times the guidance, but they don't prescribe what the absolute numbers have to be. They say that's up to the local government. They, in fact, said county boards of supervisors and public health officials at the county level can certify certain numbers of things, give that to the state, and the state will sign it off. So I think that'll be the same thing here, that a huge county, the biggest county in America, will be different than some of the counties we have, which are the smallest counties in America as well. So they're really good guidelines. They're not prescriptions that everybody has to. And I think we'll meet most of them, but we'll probably have a variance on a couple of them just given our size.
Thank you, Mayor.
Sure, you bet. Want to add anything on it?
Well, I can only talk about my relationship with the county, and that's been incredibly cooperative. We look to them to guide us with facts and science. You and I talked about some of the things that we're looking at reopening as of this week, and I think they're doing it cautiously in an attempt to try to get us to come back slowly, but also making sure that if it doesn't work or we see anything that alarms us, we'll be able to pull it back immediately. So I think they're doing the best they can, and I think we're doing our best and trying to make sure that we're on the same page. Yep. And the collaboration is there. The willingness to figure this out together is definitely there.
Yep. And so whether it's senior nursing facilities, whether it's testing, whether it's tracing, and we've offered people to help supplement with our disaster service workers, I've actually never experienced the city and county working so closely. We stood up the best testing regime in the country together. We stood up what is aggressively getting into, and we'll get to every senior nursing facility together, and our orders have always gone together too. So I'm not only satisfied, I've been pretty overjoyed with the relationship we've had. So with that, I think that was our last question. So we're gonna go to Spanish now. Thank you to our English viewers who might be tuning out. Thank you as always. Keep strong, shop local tomorrow. We'll see you on Friday. Buenas tardes, Los Ángeles, y gracias por venir. Hoy es un placer estar aquí con la presidenta del Consejo Municipal, mi amiga Nuri Martínez. Gracias por venir esta noche. Y estoy agradecido a Nuri y al Consejo por todo lo que han hecho para ayudar a angelinos durante este tiempo difícil. Antes de empezar, quisiera hablar sobre la nueva realidad que tenemos delante de nosotros.